Episode 6, Cataract Surgery, Restoring Vision and Clarity. Welcome back to MD Talk Procedures, where we explore the ins and outs of various medical procedures. I'm your host, Jarvis on Call, and in today's episode, we'll be discussing cataract surgery, a common procedure that can significantly improve vision for those affected by cataracts. Remember to join the conversation using the hashtag #MDTalkProcedures on social media. Cataract surgery is a procedure performed to remove the clouded natural lens of the eye, which occurs when proteins in the lens clump together, causing the lens to become cloudy and impairing vision. Cataracts can develop due to aging, injury, or certain medical conditions. Cataract surgery is typically recommended when the cataract begins to interfere with daily activities or negatively affects the patient's quality of life. The most common type of cataract surgery is phacoemulsification. During this procedure, the surgeon makes a small incision in the cornea, the clear front part of the eye, and inserts a tiny probe that emits ultrasound waves. These waves break up the clouded lens, and the fragments are suctioned out. The natural lens is then replaced with an artificial intraocular lens, IOL, tailored to the patient's specific vision needs. Before the surgery, patients undergo a thorough eye examination, and measurements are taken to determine the appropriate power of the IOL. The patient is given local anesthesia and often a sedative to ensure comfort during the procedure. Cataract surgery is typically performed on an outpatient basis, with most patients returning home the same day. Recovery is relatively quick, with many patients noticing an improvement in vision within a few days. It's crucial to follow the healthcare team's instructions, including using prescribed eye drops, wearing an eye shield while sleeping, and avoiding strenuous activities during the recovery period. Cataract surgery has a high success rate, with most patients experiencing significantly improved vision and a reduced dependence on glasses or contact lenses. Thank you for joining us today on MD Talk Procedures. We hope you now have a better understanding of cataract surgery. Don't forget to subscribe to our podcast for more episodes explaining various medical procedures. Join the conversation on social media using the hashtag #MDTalkProcedures.